Today, we're going to be talking about a specific endocrine gland, the thyroid, and how the thyroid feedback loop works. So the objectives from this presentation are going to be to understand the basic mechanism of the endocrine system and the negative feedback loop, identify anatomy and functions of the thyroid gland, explain each step in the production of thyroid hormones, and evaluate conditions when this process does not function correctly. So first, we have the endocrine system. The endocrine system is hormone-secreting tissues that are going to help to maintain homeostasis. When stimulated, these tissues secrete hormones that will travel throughout the bloodstream to a specific target. This is normally done in a 3-hormone sequence. First, you have your hypophysiotropic hormone that is released. This is released by the hypothalamus. This then stimulates the anterior pituitary tropic hormone to be released by the anterior pituitary gland. In the case of thyroid feedback, this tropic hormone will be released and go to the thyroid tissue, which will then stimulate the thyroid gland to create and release thyroid hormone. There's an image on the right that shows this process. The thyroid gland is a butterfly-shaped gland that is going to sit anteriorly in your neck. The thyroid is in charge of controlling metabolic rate within your body. Thyroid hormones will increase basal metabolic rate with an increase in synthesis of sodium, potassium ATPase, which will increase oxygen consumption and heat production. Metabolism becomes activated with an increase in glucose absorption, glyconeolysis, gluconeogenesis, lipolysis, protein synthesis, and degradation. These hormones also influence most other organ systems, including the cardiovascular system, by increasing cardiac output, stroke volume, heart rate, and contractility. This is also seen in the gastrointestinal tract. It will increase gastric motility and can also impact the reproductive cycle. The epithelial cells are referred to as follicular cells or thyrocytes, which surround the colloid that is located in the lumen. So this is an image that shows the thyroid feedback. So you have either cold, acute psychosis, circadian rhythm, or severe stress will initiate the hypothalamus to release TRH. TRH will then head to the anterior pituitary, which will stimulate the anterior pituitary to release TSH. TSH then makes its way to the thyroid, which will stimulate the release of thyroid hormones. These thyroid hormones, once they are increased to a high level, will then negatively feed back to the anterior pituitary and the hypothalamus, and they will stop production of thyroid hormone. So the hypothalamus is signaled again by stress, cold, or acute psychosis as some of the signals to release. Thyroid releasing hormone TRH will be released and head down to the anterior pituitary. This is done through the hypothalamic hyphoceal portal system. This is a specific portal system that is set up to be able to deliver this TRH directly from the hypothalamus to the anterior pituitary. This is going to limit the hormone traveling anywhere else within the body. So not as much as needed, and it happens very quickly to give a fast response time. In the pituitary, the TRH is received and is going to signal the anterior pituitary to release TSH into the bloodstream. This will then travel through the bloodstream to target the thyroid gland. So, thyroid stimulation. TSH is going to bind and activate the thyroid gland. It does this by activating the adenylate cyclase, which will increase CAMP levels. This will lead to the stimulation of additional intracellular signaling events that will result in the formation of the thyroid hormone. When TSH stimulates the thyroid follicle, thyroid peroxidase will then organify the tyrosine of the thyroglobulin molecule within the colloid to iodine. Iodine has already been pumped into the cell through the sodium iodine symporter. This iodine then travels through the follicular cell into the colloid so that it is ready for combination with the thyroglobulin, which was already created within the thyroid tissue. This iodine is going to bind to the thyroglobulin. If one iodine is combined, it will create an MIT, which is known as monoiodotyrosine. If two iodines are bound to the thyroglobulin, it will create DIT, which is diodiotyrosine. After these are created, the MIT and the DIT will then combine. If one MIT and one DIT bind, it will create a T3. If a DIT and a DIT bind, it will create a T4. Once T3 and T4 are created, they will then be secreted from the thyroid tissue into the bloodstream. So again, the negative feedback loop will be completed. The hypothalamus had signaled the anterior pituitary, which had signaled the thyroid. The thyroid had created these hormones, which will now go back, and they will stop the hypothalamus and the anterior pituitary from creating any more hormones. So sometimes this process does not work as well as we would like it to. Some things that can go wrong would be a goiter, hyperthyroidism, hypothyroidism, and thyroid cancer. So a goiter would happen if a person has an iodine deficiency or they're not making enough thyroid hormone. What will happen is the thyroid will grow and create more cells to try to make up for this. The image in the top right corner is an example of normal thyroid size and then in large thyroid size from a goiter. Hyperthyroidism is going to be an overactive thyroid. This could be caused by things such as Graves' disease, which is an autoimmune condition, thyroid nodules, thyroiditis, postpartum thyroiditis, having excess iodine in your blood from diet or medication, over-treating hypothyroidism through medication, or a benign tumor that's in your pituitary gland. So with hyperthyroidism, with the immune condition or the thyroid nodules, what is happening is it's not following that feedback loop. So it's operating outside of the loop, so it continues to make hormones. So for these patients, they're going to have a low TSH and high thyroid hormones. However, that low TSH is not causing the thyroid to stop creating hormones. It just continually creates hormones. With any kind of thyroiditis or thyroid damage. What is happening is when the thyroid is damaged, it will just dump the T3 and T4 that it has stored already inside of it into the bloodstream. So this creates an increase in thyroid hormones, even though it's not necessarily caused by the thyroid tissues working harder and creating more. And then again, over-treatment of hypothyroidism through medication. That would mean you're taking a medication that is stimulating the thyroid, but you're taking too much in that it's causing the stimulation to be too great, creating too much thyroid hormone. Hypothyroidism. So this is going to be an underacting thyroid. And I do have examples of symptoms that would come with both of those. So again, the thyroid creates metabolic rate within the body. So a high metabolism is going to cause racing heart, nervousness, anxiety, heat intolerance. The patient's going to feel very hot, increased sweating, muscle weakness. And then the opposite is going to be for hypothyroidism. They're going to feel very cold. They're going to have depression. They're going to have a slow heart rate. They're going to feel very fatigued. They're going to kind of just feel very slow. Hypothyroidism at a young age can also cause growth retardation or mental retardation. So it is important to be able to identify this, to be able to treat the patient very early on. And then thyroid cancer is a cancer that will begin with thyroid tissue. Approximately about 53,000 people in the United States will receive a diagnosis of thyroid cancer, but treatments for most of these cancers are very successful. The different kind of cancers are based upon the type of cells from which the cancer will grow from, and they include papillary, which is about 80% of all thyroid cancers, follicular, medullary, and anaplastic. And these are my references that we use for this presentation. Thank you.